Good evening, everyone, and welcome to our webinar. My name is Brianna, and I am the Associate Director of Community Engagement and Events at Alley Cat Allies. And for tonight, I will also be your moderator. This is our Better Together, TNVR, and Public Health webinar with extra emphasis on the V, which stands for vaccinations this evening. We have a lot of great information to share with you, but before we get to that, I do have just a few slides I want to go through. First of all, I want to encourage everyone to take notes. Like I said, we have a lot of information to share. If you do feel like we are going too fast or that you've missed some of the information, please don't worry. We are recording tonight's session. That's right. We are recording the session, and everyone will get a link to that recording in a follow-up email. In that follow-up email, you will also get a link to a survey. We are always trying to improve our online resources, so if you have advice, recommendations, or things that you'd like to see in the future, please go ahead and let us know. And so I did mention that we are recording. Not only will you have the link in an email, but you can access this in any of our webinars online at alleycat.org/webinar. And there you will see all of the webinars we have available. And so I do want to point out one webinar that we have coming up next week. This will be the second webinar in our new Animal Care and Control series, working with animal control and shelters to save more cats. And this will be a great resource for anyone who's looking for ways to build community through community cat programs. We have lots of previous webinars that we've done that I think that will be very useful to you, but I do want to call attention to our Kitten Care series. This is a 4-part series presented by the National Kitten Coalition. It starts out with 2 webinars focused on how to care for bottle babies, and these are great for anyone who's fostering a neonatal kitten. And then our last 2 are again great for fosters, but they're also helpful for anyone in the veterinary field. Basic kitten medical issues and neonatal kittens in the veterinary clinic are both presented by licensed veterinary technician Rosemarie Crawford. So all these webinars and many more are online. But back to tonight's presentation. We do have 60 minutes this evening, and so we have a lot of information to share, and we hope to get to your questions at the end. And so if you use your toolbar to submit a question the way you see on screen, I will be queuing those up, and hopefully we'll be able to answer them live on air tonight. We do have an incredible website, though. It is just full of information. So if you do have any questions in the future, go ahead and visit alleycat.org/get-help. I do want to just briefly mention a few programs Alley Cat Allies has, and the first of which is our Feral Friends Network. This is an incredible resource for anyone who's looking to help cats in their community. It is a listing of people and places who are helping cats, whether they're individuals or shelters or rescues or even veterinarians. It is a phone book for cat people, as I call it, and so if you would like to advertise your services for community cats, head on over to alleycat.org/feralfriends to learn a bit more and maybe even submit an application. So it is that time of year again where shelters are starting to see more and more kittens coming in. And so Alley Cat Allies has been advertising our Wait Until 8 program, and this is a great tool for anyone who's looking to empower their community to keep neonatal kittens and foster them at home rather than bringing them to the shelter and, giving them the love, care, and attention they need until they reach 8 weeks of age. And so we promote our kitten care kits, which will give fosters everything they need to care for that kitten and help shelters focus on other animals that need their attention too. And so, of course, we have our Plan to Scan campaign, and as veterinarians, you already know this. You don't need me to tell you, but you play a critical role in helping your clients and patients understand the importance of microchipping. And so we hope that you are talking about microchipping and scanning any new clients that you see, especially community cats that might come in too. If you have questions about how to scan a cat, or particularly a feral cat in a trap, we have that information for you. Head on over to alleycat.org/plan-to-scan. Oh, that was a lot, so thank you for sticking with me. But on to tonight's presentation. I am very delighted to announce that tonight's presenter is Dr. Bob Weedon. I've had the pleasure of knowing Dr. Weedon for, I think, over 3 years now, if I can believe it, which I can't. But Dr. Weedon is the director of the shelter medicine program and a clinical assistant professor in the College of Veterinary Medicine at the University of Illinois. He was also the shelter veterinarian at the Champaign County Humane Society from 2011 to 2016, where he got his start with the shelter medicine program. Since being involved with the shelter medicine program, he has trained more than 400 students in high-quality, high-volume spay-neuter. Currently, he oversees the university's mobile spay-neuter clinic, which travels to rural parts of Illinois and sterilizes about 235 cats each month, and over 20% of those are truly feral cats. He attained his DVM from Purdue University and his Master of Public Health degree from the University of North Carolina, Chapel Hill. And so Dr. Weedon's going to talk about a lot of things this evening, but here's a rough outline for you. We're going to start off by talking about TNVR. What is it? And then, of course, why TNVR? And then we're going to move on to the public health aspect, which is why I think most of you are here. We're going to talk in depth about rabies and toxoplasmosis. So without further ado, that's enough from me. Over to you, Dr. Weedon.
Thanks, Bree. Has it really been 3 years? Seems like more than that. Good evening, everybody. As Bree said, my name is Bob Weedon. I am a veterinarian, been involved with Trap-Neuter-Return programs for, oh gosh, a long time. And it's really a pleasure to be here to talk to you tonight about the public health benefits. And one of the reasons, Bree, if you could go to the next slide, that I advocate for the moniker TNVR. So what exactly do we mean by TNVR? Well, some other terms you'll hear are SNR, shelter neuter return, and RTF, return to field. These speak to the increasing role of animal shelters and animal control agencies are playing in TNR. Increasingly, some, and I am a strong advocate, are saying Trap-Neuter-Vaccinate-Return, TNVR, to make the vaccination portion explicit. While in most cases, rabies vaccines have always been a part of TNR, that has not always been the case. And I'll be using TNVR here to reinforce the importance and how TNVR supports public health. Next slide, Bree. So you're probably familiar with the term TNR. You probably wouldn't be here if you weren't. Trap-Neuter-Return. But I'm now advocating, and not just me, there are others in the field that are advocating for the term TNVR. The V stands for vaccinate, which emphasizes the public health aspect of TNVR programs, including vaccinating for rabies as a means of protecting the health of the public. I've had some conversations with people around the country about this, and the consensus is starting to form that we actually are getting more traction with municipalities by demonstrating the public health benefits of Trap-Neuter-Vaccinate-Return programs. I mean, it's nice to say, yes, TNR saves cats' lives, and I'm all for that. I'm all for a humane solution to the problem of free-roaming cats, community cats, but I think we get more traction in terms of municipalities embracing the humane alternatives to deal with the problem of community cats by emphasizing the public health aspect. Next slide, Bree. So in a study published in the Veterinary Journal in 2014, Levy et al. Reported that high-impact TNVR combined with the adoption of socialized cats and nuisance resolution counseling for residents is an effective tool for reducing shelter cat intake. As you can see from these graphs here, annual per capita community Trap-Neuter-Vaccinate-Return surgeries in the target area, A, increased significantly during the 2 years, years 1 and 2 at the far right side of the top graph. This was accompanied by a significant decrease in shelter cat intake and euthanasia. In the non-target area, the lower graph, B, annual TNVR surgeries remained at the baseline rate, and shelter cat intake and euthanasia did not change significantly. Per capita results are reported as cats per 1,000 residents, and the asterisk, as you can see in the upper graph, is interpreted as significantly different than mean plus or minus 2 standard deviations of the 5 pre-treatment years. Next. Numerous studies have shown that fertility control via TNVR is effective in reducing cat colony size over time. And as the Levy et al. Article reported, which you see here, approximately 2 to 3 million cats enter animal shelters annually in the U.S. A large proportion of these are unowned community cats that have no one to reclaim them and may be too unsocialized for adoption. Next. The Levy et al. Study confirmed that caring for unowned community cats is a common activity and that community cats accounted for almost half of the local cat population. A program of concentrated community outreach, high-volume TNVR, and adoption in an 11.9 square kilometer, 4.6 square mile area of high shelter cat intake resulted in a 66% decrease in shelter impoundment over 2 years. Next. According to the National Council on Pet Population Study and Policy Shelter Statistics Survey, more than 70% of all cats who enter U.S. shelters are euthanized. For community cats who aren't socialized to humans, this number is nearly 100%. Next. So we've kind of mentioned the importance of sterilization. And now we're going to kind of drill down a little bit and talk about the V part. But I want to just kind of set that conversation up by addressing why TNVR. And this slide, I think, does that nicely. Because before TNVR, we had trap and kill. It's cruel, it's costly, and quite honestly not effective. I mean, we've been doing it for decades. Why does it not work? Well, a number of reasons. I mean, people don't want to see the cats being killed. There is survey evidence that I'll present a little bit later that documents that. If you're familiar with the vacuum effect, there's significant scientific literature confirms that when cats are removed, others repopulate the area. And it's not possible to remove all the resources. You know, you're not going to get all the cats either. And the population, because they are reproductively capable, will rebound. And, you know, from the public health perspective, the new population is not vaccinated. And that, as I will show you in a little while, is really important. You don't have to vaccinate every cat in a colony to make a difference. Finally, there's the financial cost. People don't volunteer for trap and kill programs, but they sure do for TNVR. So taxpayers then have to pay the cost of the cats being trapped and killed. Next. I wish I could see a show of hands. I can't. I'm Can't see you guys. Probably fortunate that you can't see me, or there are some who would say that. But I'd like to see a show of hands. How many of you know what a slide rule is? And I think of TNVR as a slide rule. Imagine, for those of you that are old enough that used a slide rule, and I did, I was old enough, imagine being the slide rule manufacturer the day the pocket calculator came out. I liken TNVR to a slide rule. Something better is going to come along, but until that time, it's better than doing nothing. Next. I mean, if you think about it, TNVR is the best public policy for community cats. It reduces shelter intake and euthanasia. It reduces public calls to the municipality. It has been shown, and if we had more time, I would present some really interesting data. My friend John Boone, who is also a board member of the Alliance for Contraception in Cats and Dogs, has done some really terrific modeling work that shows that TNVR actually saves taxpayers money. And it is supported by the public. 80% of Americans were surveyed said they would rather leave a cat in her outdoor home than have her caught and killed. Next. The bottom line is, if we get rid of the slide rule, then we go back to the abacus. You know, put simply, trap and kill doesn't work. So should we be doing nothing or do TNVR? You know, and one of the things that really annoys me is that opponents of TNVR programs don't offer any alternatives other than trap and kill. We all know that doesn't work, not to mention it's not humane. I mean, we've been doing it for decades. And remember, saying something doesn't work doesn't do anything to help solve the problem. Next. According to the American Public Health Association, public health promotes and protects the health of people and the communities where they live, learn, work, and play. A doctor may treat a person who's sick. Those of us who work in public health try to prevent people from getting sick or injured in the first place. From conducting scientific research to educating about health, people in the field of public health work to assure the conditions in which people can be healthy. Promoting the public health aspect of TNVR programs gets the attention of a much larger audience. We're not just talking about saving cats' lives, but potentially the lives of people as well. Next. Recent attacks on TNVR programs have focused on free-roaming cats being a threat to the public's health. There is a lot of misinformation out there. Probably the most notable attack on TNVR is the recently published book, Cat Wars: The Devastating Consequences of a Cuddly Killer. According to Mara, who's been with the Smithsonian Institution's Conservation Biology Institute since 1999 and now runs its Migratory Bird Center, outdoor cats are, quote, unrelenting killers and cauldrons of disease, unquote, whose, quote unquote, devastating consequences must be dealt with by eradication in the name of biodiversity. Quote, from a conservation ecology perspective, the most desirable solution seems clear. Remove all free-ranging cats from the landscape by any means necessary. Since when did killing one species in the name of another ever make any sense? Recently, opponents of TNVR programs have focused on two public health issues, rabies and toxoplasmosis, in their efforts to scare people regarding the apparent threats to these diseases posed by feral and free-roaming cats. We're going to focus on these two diseases and demonstrate why TNVR programs actually serve to protect people in their communities from these threats. Next. One of the diseases that opponents of TNVR programs call into question is rabies. Rabies is arguably the poster child for the One Health initiative, which recognizes that human health, including mental health via the human-animal bond, animal health, and ecosystem health are inextricably linked. One Health seeks to promote, improve, and defend the health and well-being of all species by enhancing cooperation and collaboration between physicians, veterinarians, and other scientific, health, and environmental professionals by promoting strengths in leadership and management to achieve these goals. Next. Every year, the Centers for Disease Control and Prevention publish rabies surveillance in the United States during the previous year. This comprehensive document lists the numbers and percentages of wild and domestic animals diagnosed with rabies. It also gives guidance for what is considered exposure. For instance, it says, any animal bitten or scratched by either a wild or carnivorous mammal or a bat that is not available for testing should be regarded to having been exposed to rabies. So this is it's a comprehensive document that comes out every year that looks at the previous year's data. Next. So statistics for the latest year available show that cats accounted for 61.1% of the rabid domestic animals reported in 2014. That's a 10.12% increase compared with 247 reported in 2013. Most of the rabid cats were reported from states where the raccoon rabies virus variant is considered enzootic: Pennsylvania, Virginia, New York, New Jersey, and Texas. Next. It is important to note that the 10.12% increase in feline rabies during 2014 does not signal a significant increase. As a matter of fact, here's some data courtesy of the CDC that shows that while there are annual fluctuations, the incidence is pretty flat over the past decade and a half. And the 272 cases reported in 2014, while an increase of 10.12% over 2013, is actually below the average of 283 reported during the period of 2009 through 2013. It's pretty much in line with the average during the period 1989 to 2014. Next. Here's a graph from Green's textbook of infectious disease of the dog and cat 4th edition, which shows dog, cat, and wild animal rabies numbers over the past half century. Notice the incidence of dog rabies decreasing in the late 50s and early 60s, as well as the increase in wildlife rabies during the period. This is generally believed to be due to mandatory vaccination of dogs by states and municipalities in the U.S. Accordingly, cats now have a greater incidence of rabies than dogs. And it's interesting to look at this because you see the wild animal rabies has skyrocketed really compared to both dog and cat rabies. And that begs the question, are we seeing more rabies or are we just seeing it more? And, you know, it's hard to say. I think to some extent a lot of that has to do with how society is encroaching upon areas where wildlife used to only inhabit by new developments, as well as more green space, parks. People are getting out and enjoying nature more. And so we're actually seeing more rabid animals. Does that mean there's more rabies, or we're just encountering it more? It doesn't matter. The fact that there are more reported cases of rabies in wildlife is cause for concern to those of us who are trying to manage colonies of community cats. We want to make sure that they are protected against that potential threat. Next slide. So this is an image from that report that shows the distribution of the major rabies virus variants among mesocarnivores in the U.S. and Puerto Rico from 2008 to 2014. Kind of interesting. You see how they're clustered in different areas around the United States. Next. These are reported cases of rabies in raccoons by county during the year 2014. Next. Same document has a nice image of reported cases of rabies in cats by county 2014. Do you notice a correlation? Next. Now look at them side by side. Now do you notice anything? Most of the rabid cats were reported from states where the raccoon rabies virus variant was considered enzootic. Next. So in the report, Rabies Surveillance in the United States during 2014, it discusses human rabies since 2003. It says, rabies has been diagnosed in a total of 37 persons in the United States since 2003. 26 of the 37 acquired the disease in the United States or Puerto Rico. Organ or tissue transplantation was identified as a source of infection for 5 of these 26. Next. It goes on to say that bats were implicated as the source of infection in 17 of 26 individuals. The remaining 4 consisted of 2 patients who were infected with a raccoon rabies virus variant, 1 who was infected with the mongoose virus variant in Puerto Rico, and 1, the only patient who survived, who was infected with an unknown rabies virus variant. Next. Nowhere in this report does it list the cat as a source of exposure for a person acquiring rabies during 2014, the latest year for which reporting exists. As a matter of fact, rabies surveillance in the United States during 2006, which was published in the Journal of the American Veterinary Medical Association during 2007, says the last documented case of human rabies from exposure to a rabid cat was in 1975. Next. But the fear-mongering is out there. People are talking about free-roaming cats being a threat to human health, and I'm arguing that we should refer to TNVR to emphasize the vaccination component, the public health aspect, as a means of protecting the public's health. Next. An important concept to understand is that of herd immunity. Herd immunity is a form of indirect protection from infectious disease that occurs when a large percentage of a population has become immune to an infection, thereby providing a measure of protection for individuals who are not immune. Individuals who are immune to a disease act as a barrier in the spread of disease, slowing or preventing the transmission of disease to others. I'm going to show this diagrammatically in the next slide. These diagrams illustrate how rabies could spread in a susceptible colony of feral cats if each infected animal were exposed to 2 other cats. The plus sign represents an infected animal, the minus sign represents an uninfected animal, and the circled minus sign represents an immune cat who will not pass the infection on to others. Next. In the absence of herd immunity, the number of cases doubles each disease generation, as you see here on the left side in A. In B, we see that in the presence of 50% herd immunity, the number of cases remains constant. Now remember, the plus sign is an infected animal, the minus sign represents an uninfected animal, and the circled minus sign represents an immune cat who will not pass the infection on to others. So you see in the very bottom row, there's a whole lot more plus signs in the absence of herd immunity than there is on the right-hand side. Next. Now, these diagrams illustrate how rabies could spread in a susceptible colony of feral cats if, through trap and remove programs, a previously vaccinated cat is removed from the colony. In this case, it would be replaced by a non-vaccinated cat. And then you see an increase in the incidence of disease. So if the 2 cats on the left, as you see them circled, if they're removed and they come in contact to a rabid animal, then you'll see they're replaced by plus signs. And then the other negatives down at the bottom, you see that came in contact, those, because they came in contact with a positive animal, now have the disease. So you see, simply bring 2 vaccinated cats in this little colony, look how the incidence of rabies in that colony increases. This is one of the reasons that I argue that if we're going to be effective with TNVR, we can't be fighting other groups who are trapping and killing. Because if you remove an animal that has immunity to rabies, then you are effectively weakening herd immunity. Next. So there's a lot of confusion out there about rabies vaccines. 1 year, 3 year. This confusion exists around 2 distinct but similar concepts: the labeled duration of the vaccine and the duration of the certificate issued at the time of vaccination. Next. Now there's guidance in the form of the Compendium of Animal Rabies Prevention and Control, the latest issue published on March 1st of 2016. The compendium is updated every few years, but this latest iteration was 5 years in the making. This is because there was some ongoing research that documented the fact that dogs and cats who had been previously vaccinated but were overdue had just as robust an anamnestic response as those who were currently vaccinated. The scientific evidence fundamentally changed the guidance in the compendium with how to handle animals who had been previously vaccinated but were not currently vaccinated and yet were exposed to a rabid or potentially rabid animal. It also supports the contention that one rabies vaccine administered to a free-roaming cat protects far longer than the recommended 1 year time to booster that vaccine. Next. However, because of the public health implications and laws regulating rabies vaccination, veterinarians have little leeway in terms of rabies vaccination schedules. It is important to note that animals who receive their initial rabies vaccination should be boosted in a year, regardless of whether a 1 or 3 year licensed vaccine is used. Next. It is also important to note that the compendium says If a previously vaccinated animal is overdue for any booster vaccination, including the first booster vaccination due 1 year after initial vaccination, it should be given a booster vaccination. Immediately after this booster vaccination, the animal is considered currently vaccinated and should be placed on a booster vaccination schedule consistent with the label of the vaccine used. There is no laboratory or epidemiological data to support the annual or biannual administration of 3-year vaccines after completion of the initial vaccine series. Now this is really important because that shows the previous slide that we talked about, the study that compared response to dogs and cats that had been previously vaccinated but were not current. When compared to animals that were current, there was no statistically significant difference in their antibody response. So for this reason, if a feral cat is vaccinated and sterilized and not trapped immediately at a year, it's still going to get a good anamnestic response to a booster vaccination. Next. That said, you know, the reality is that feral cats may only receive 1 rabies vaccine in their lifetime, even though many caregivers do their best to revaccinate. Accordingly, we advocate for using a 3-year licensed vaccine because it offers the longest duration of protection. And that's what we use in our program here at Illinois. Next slide. So the question comes up, what is the difference between a 1 and a 3-year vaccine? The Code of Federal Regulations 9, Animals and Animal Products, is the document that regulates the licensing of biologicals used in animals. This includes rabies vaccine. Next. Now the CFR wording is really complex, and I've listed it here for you. And happy to send you a copy of it, or you can get it online. But basically, it outlines what manufacturers need to do to license a rabies vaccine. It says 25 or more animals shall be used as vaccinates, 10 or more additional animals shall be held as controls, and then it talks about how they're tested for response to the vaccine. Next. For a 1-year vaccine, quote, all surviving test animals shall be challenged intramuscularly with virulent rabies virus furnished or approved by the Animal and Plant Health Inspection Service 1 year after vaccinations, unquote. Requirement for acceptance in challenge tests shall be death due to rabies in at least 80% of the controls, while at least 22 out of 25 or 26 out of 30, or a statistically equivalent number of vaccinates, remains well for a period of 90 days. Next. For a 3-year vaccine, the CFR says if more than 1 year duration of immunity is to be claimed, a duration of immunity test for the additional time shall be conducted and interpreted as prescribed in paragraph B of this section, which is what I just read to you, for the 1-year test. The test animal shall be monitored serologically at least every 180 days. The time of challenge may be adjusted accordingly. Next. This means that in order to license a 3-year vaccine, immunologically naive animals need to receive a dose, and 22 out of 25, or 88%, or 26 out of 30, 86.7%, need to be protected. 3 years post-vaccination. Now, at this point, it's probably worth mentioning that legally, veterinarians cannot recommend rabies vaccination protocols that are outside of the label requirements approved by the USDA. Since rabies is a reportable disease, there is less leeway in vaccination protocols than with other diseases. Next. But I want you to remember, this means that in order to license a 3-year rabies vaccine, immunologically naive animals need to receive 1 dose, and 22 out of 25 or 26 out of 30 need to be protected when challenged 3 years later. The reality is that feral cats may only receive 1 rabies vaccine in their lifetime. Accordingly, we advocate for using a 3-year licensed vaccine because it offers the longest duration of protection. Next. And there's published evidence in support of that. Fisher et al. Published an article in JAVMA entitled Response of Feral Cats to Vaccination at the Time of Neutering. Next. This article showed that prior to vaccination, some cats had protective serum antibody titers, but only 3% of them had antibodies to rabies virus. Notably, following vaccination, 98% of the cats had protective serum antibody titers. Next. Their conclusions were that feral cats appeared to have an excellent immune response following vaccination at the time of neutering, and that incorporation of vaccination into Trap-Neuter-Return programs is likely to protect the health of individual cats and possibly reduce the disease burden in the community. Next. They also concluded that vaccination of feral cats at the time of neutering may protect them for much of their remaining lifespan because immunity that develops following vaccination has been shown to persist for a minimum of 3 to 7 years in most cats. Ideally, feral cats should be recaptured and receive booster vaccinations, particularly with a vaccine against rabies, according to the guidelines established by the American Association of Feline Practitioners. However, we know that this is not a practical consideration. And I argue that one rabies vaccine in a feral cat is better than no rabies vaccine. You only have to go back to our discussion of herd immunity to see that value. Next. Again, we're promoting the vaccination component to protect the health of the public. Next. I'm going to shift gears here a little bit in our remaining time. I want to be sure to leave time for questions. So Maris says in his book, quote, toxoplasmosis, the disease caused by Toxoplasma gondii, is the most common parasitic infection in humans. In fact, it is estimated that approximately 30 to 50% of the world's population and up to 22% of the U.S. population, more than 60 million Americans, are infected with Toxoplasma gondii, somewhat less than half of them due to direct ingestion of the Toxoplasma oocyst excreted into the environment by cats, most likely domestic cats, unquote. Now, I don't know about that. The CDC lists malaria as causing the most deaths globally and infecting 200 million people per year. But more importantly, they also say that the most common way to be exposed to the Toxoplasma organism is by eating undercooked food, not ingestion of oocysts. Mara also links toxoplasmosis to schizophrenia in humans, saying, quote, that individuals infected with toxoplasma were 2.7 times more likely to develop schizophrenia compared to individuals without toxoplasma infection. Furthermore, 4 recent studies report that individuals with schizophrenia compared to controls have had more contact with cats during childhood. The research cited in Mara's book has been discredited by rigorous scientific review. We're going to look a little closer at toxoplasma and consider the facts. Next. Now, the life cycle is really complex and it's well beyond the scope of this webinar, but the enteroepithelial cycle is found only in the definitive feline hosts. So they shed infective organisms in their feces. That's a given. The extraintestinal development of T. gondii is the same for all hosts, including rodents, dogs, cats, humans, and is not dependent upon whether tissue cysts or oocysts were ingested. So you can get toxoplasmosis by ingesting oocysts or tissue cysts. It's really complicated, but I'm going to try to simplify it a little bit for you. Next, please, Bree. The media has picked up on Mara's claim that of all those infected in the U.S., quote, somewhat less than half of them are due to direct ingestion of toxoplasmosis excreted into the environment by cats, unquote. The implication there is that cats are infecting people. There is substantial evidence to the contrary. I think it is important to note that most cats become infected from carnivorous behavior soon after weaning and shed oocysts for only short periods, under 3 weeks, thereafter. According to Green's Infectious Diseases of the Dog and Cat, ingestion of undercooked meat or contamination of undercooked foods by cutting boards used to prepare raw meat is a common source of toxoplasma infection in humans. Next. As a matter of fact, it used to be recommended that pregnant women get rid of cats because of the risk of toxoplasmosis. Substantial scientific evidence now exists that given that individual cats provide human emotional health benefits and are not a direct risk factor for acquiring toxoplasmosis, where good hygiene is practiced, relinquishing them is unnecessary. Next. According to the CDC, the most common way for people to become infected with toxoplasma is eating undercooked, contaminated meat, accidental ingestion of undercooked, contaminated meat after handling it and not washing hands thoroughly, eating food that was contaminated by knives, utensils, cutting boards, or other foods that had contact with raw, contaminated meat. Next. As a matter of fact, the CDC has produced a poster listing toxoplasmosis as a leading cause of death from foodborne illness in the U.S. Foodborne illness. Next. Some have tried to make a tenuous link to a high prevalence of T. gondii specific serum antibodies or strong correlation of obtaining a cat during childhood in humans with schizophrenia. However, these studies have not been confirmed or documented evidence of transmission and therefore are open to questions. Next. One study examining the presence of T. gondii by PCR of cortical brain tissue from psychiatric patients was not incriminating. And further studies may need to be done in order to determine if an association exists between infection and human behavior and biology, although there's been some really neat stuff that's come out recently that I'm going to share with you. Next. It is important to note that the studies cited by Mera and Green have been criticized for their conclusion and raise serious doubts about the ability to identify cat ownership as a factor for the development of schizophrenia. Next. As a matter of fact, a recent report on CNN discussed an article published in the medical journal Psychological Medicine. This new study is the first to prospectively look at childhood cat ownership and the infection of the parasite Toxoplasma gondii as a risk factor for psychosis. The study's conclusion, quote, while pregnant women should continue to avoid handling soiled cat litter, given possible T. gondii exposure, and I'm not so sure I agree with that, our study strongly indicates that cat ownership in pregnancy or early childhood does not confer an increased risk of later adolescent psychotic experiences. Next. And this is actually a copy of the study that was published in Psychological Medicine. The new study looked at nearly 5,000 people in the United Kingdom who were born between 1991 and 1992 and followed them until the age of 18. The researchers used birth information to determine whether households had cats when the mothers were pregnant and when the children were growing up. At ages 13 and 18 years, the children were brought into clinics to be evaluated for psychotic-like symptoms. After controlling for potential confounding factors, the study concluded that cat ownership in pregnancy and childhood did not play a role in developing psychotic symptoms during adolescence. Quote, "The message for cat owners is clear. There is no evidence that cats pose a risk to children's mental health," unquote. Francesca Salmi, the lead author of the study, said in a news release, quote, "In our study, initial unadjusted analyses suggested a small link between cat ownership and psychotic symptoms at age 13, but this turned out to be due to other factors." Next. As a matter of fact, according to the National Institute of Health, research has identified several factors that contribute to the risk of developing schizophrenia. Genes in the environment, different brain chemistry and structure, no mention of Toxoplasma gondii as being implicated. Next. It's known that in the immunocompetent human, toxoplasmosis is generally benign. It, in many cases, is asymptomatic. In contrast, immunosuppressed individuals may develop serious illness with encephalitis, pneumonitis, or myocarditis. The unborn fetus, individuals with HIV, AIDS, or those on chemotherapy are particularly at risk for complications. So if you're an unborn fetus or have AIDS or on chemotherapy, be sure to wash your hands and properly cook your meat. Next. It's important to remember that typically cats shed oocysts no longer than 2 weeks after their first exposure and generally do not shed them again. Despite the infrequency of cat-associated toxoplasmosis, many physicians, including obstetricians, gynecologists, still focus on cat litter disposal measures and overlook other important sources of food ingestion or environmental exposure. Sometimes I don't get it. Next. The National Health and Nutrition Examination Survey, so-called NHANES, is a program of studies designed to assess the health and nutritional status of adults and children in the U.S. The NHANES program began in the early 1960s and has been conducted as a series of surveys focusing on different population groups or health topics. In 1999, the survey became a continuous program that has been changing focus on the variety of health and nutritional measurements to meet emerging needs. The survey examines a nationally representative sample of about 5,000 persons each year. These persons are located in counties across the country, 15 of which are visited each year. Findings from this survey will be used to determine the prevalence of major diseases and risk factors for those diseases. Information will be used to assess nutritional status and its association with health promotion and disease prevention. In their article in Emerging Infectious Diseases entitled Toxoplasma gondii Infection in the United States, 1999 to 2000, Jones et al. Said that they tested sera collected in the NHANES from 99 to 2000 for T. gondii specific IgG antibodies and compared these results with results from sera obtained in NHANES 3, which is 88 to 94. And of the 4,234 persons, 12 to 49 years of age, in NHANES 99 to 2000, 15.8% were antibody positive. Next slide, please. They went on to conclude that no statistically significant differences were found between T. gondii antibody prevalences in NHANES 99 to 2000 and NHANES 3. T. gondii antibody prevalence has remained stable over the past 10 years in the United States, this according to this one publication. Next. Now, the literature is a little confusing and a bit contradictory because Kruger et al. Reported that in a cross-sectional analysis of NHANES data that the seroprevalence among U.S.-born persons 12 to 49 years of age significantly declined to 6.6% in 2009 to 10 compared to previously published reports for NHANES data from 1988 to 1994, which was 14.1, and 99 to 2004, which was 9. So there's some conflicting data here. One says stable, one says decreasing. The bottom line is, next, that the NHANES 99 through 2006 survey content brochure lists 2003 to 4 as the last year Toxoplasma was part of the laboratory component for NHANES. Next. As you can see here, I don't know how well it's going to show up, but it's not been part of NHANES ever since. You see the circled area there is blank. This says something about how seriously they don't take it. Next. One textbook of zoonotic diseases said cats have gotten a bad rap about how they transmit toxoplasmosis to humans and how they cause spontaneous abortion in women and blindness and mental retardation in newborn and other children. While it's true that cats are the only definitive host for the infected stage of Toxoplasma organism, they are not the most common source of human infection. The most efficient way to get toxoplasmosis from a cat is to eat the cat under, that is a quote, out of Colville and Berryhill, Handbook of Zoonosis. Next. So I want to leave some time for questions, and I want to just reiterate, feral cats appear to have excellent immune response, so vaccinating them against rabies has been shown to improve herd immunity and develop a barrier to the disease for domestic animals and people. Next. There is substantial scientific evidence that when properly applied, TNVR has been shown to help control or reduce the population of free-roaming cats. Just remember, we're emphasizing the V for vaccination as a means of protecting the health of the public. Next. Next. I always finish up my lectures with students with some words of wisdom. And I think this is really apropos to this, this talk. What we see depends mainly on what we look for. So true when it comes to the humane management of feral and free-roaming cats. Next. There's my email address if you have any questions. Bree, I know we're kind of running, we got a little bit of a late start, but we've got a few minutes for questions, and I'm happy to take any of them at this point in time.
All right, thanks so much. Yeah, as Dr. Weedon said, we have time for a few questions. So getting right into it, could you please discuss using the rabies vaccine in kittens younger than 12 weeks when the labeled minimum age at the time they are sterilized, between 6 to 11 weeks?
Okay, that's a really good question, and something that there are several of us who are really interested in looking at. That is considered off-label use. The label says that the vaccine is for cats 12 weeks of age and up, and we all know that when we trap feral kittens, if they're just totally unsocializable, you know, they may get returned. Ideally, if you can trap a kitten and get it out of the colony and into a foster home and socialize, it can be adopted, but that doesn't always work. So we typically vaccinate kittens that are obviously under 12 weeks of age. Now, there's no scientific evidence to say that that works, so we are actually looking at doing a research project here at Illinois looking at antibody response to kittens between 8 and 12 weeks of age, 8 weeks typically being the youngest age that we would sterilize a feral cat. So right now I know people are doing it. It's off-label, so those animals are considered non-vaccinated. They cannot get a rabies certificate. I personally believe in it because it is likely that may be the only rabies vaccine that animal gets. Do I have scientific evidence behind me to say that it works? No. But I hope to get that within the next year or two. It's something that a project we're looking at putting together, and I think it's a very important important project because we do vaccinate feral cats younger than 12 weeks of age. Did that answer the question?
So, all right, next question. What is your feeling on vaccinating for FVRCP with the feral cat?
FVRCP, feline viral rhinotracheatis, which is now known as feline herpes virus type 1, Calesi and panleukopenia, which is the colloquial name is feline distemper. FVRCP is part of our vaccine protocols. Our feral cats get sterilized, ear-tipped, tattooed, because sometimes, ear tips can be missed or for whatever reason. They also get vaccinated for FVRCP, they get vaccinated for rabies, and they get microchipped. And the microchip is something that we've been doing in conjunction with Alley Cat Allies to look at where some of these cats end up. Plus, even more importantly, if we have a feral cat that's been microchipped and it bites somebody, then you have documented proof that that animal has had a rabies vaccine. And that's really important because if you got a colony of a dozen cats, well, the black one with a little white on his chest isn't probably going to satisfy animal control. But if you have a cat that's got a verifiable microchip and you have records that it received a rabies vaccine, now, if it were, again, under 12 weeks of age, it may not be considered current, but the point is it's had it and you can prove it. So that's our reason for microchipping. But to answer the question, yes, we vaccinate for FVRCP as well.
All right, excellent. And then I think we have time for one more question. This isn't directly related with vaccinations, but I think it is important when we're talking about offering veterinary care to community cats. And so this question does come from a fellow veterinarian. What is your policy when you are dealing with a TNR cat with wounds of unknown origin? Do you inform the caregiver? Do you euthanize? How do you handle that?
Well, that's a really difficult question. My friend Katie Brown, who, and by the way, if any of you want a copy of the compendium, you can get it, the National Association of State Public Health Veterinarians, or shoot me an email. My email address is there. I'll be happy to send you a copy. My friend Katie Brown, who's a state public health veterinarian in Massachusetts, and I have friendly disagreement about this topic. We just co-authored a chapter on rabies for the second edition of Infectious Disease Management in Animal Shelters, and we address this in there. And to some extent, actually to a large extent, it depends on rabies epidemiology in the area. In Illinois, the last rabid cat in the state up until last October, there was a little rabid cat up in the northwest suburbs of Chicago, was the last rabid cat previous to that was 1995. So rabies is not real common here. As a matter of fact, the only animals that have been diagnosed with rabies in that span of time were bats, with the exception of one cow in 2011. Go figure. It was bat variant. It got it probably from a bat bite. Point is that we don't see raccoon rabies here in Illinois. We don't see feline rabies here in Illinois. Our policy is if we have a wound of unknown origin, we give it a slugger convenia and advise the colony caretaker and to keep an eye on the cat. And if they start reporting abnormal neurologic behavior, then that's a whole different ballgame. The other thing to consider is, what does your local rabies authority have to say about wounds of unknown origin? I mean, the same could be said for, a cat or a dog that comes into an animal shelter. Wounds of unknown origin, if you're in a rabies endemic area, you may manage that case much differently than if you're in an area where rabies is not endemic. So I guess the Cliff Notes or Reader's Digest version answer to that question is A, depends on what the local rabies authority says, and B, depends on rabies epidemiology in your area.
All right, I think that was a very thorough response. Well, thank you so much, Dr. Weedon. I think that's going to about wrap it up for us here this evening.
Okay.
So I do want to thank everyone who joined us. And yeah, I hope you have a great night. I see everyone stuck around for the question section, so even though we ran over time, so thank you so much for hanging out with us this evening. Thank you, Dr. Weedon, for a great presentation.
Yeah, and feel free to email me. My email address is there on the screen. Shoot me an email if you have other questions. I'm happy to if I don't know the answer, I'll do my best to get the resources to get it for you. Okay.
All right, that's incredibly helpful. Thank you. And of course, you can always reach out to us at alleycat.org. And until next time, everyone, thanks for all you do. Have a great night.
All right. Thanks, Bree.